Okay, we are live. Welcome, everyone. Hope everyone can see us and hear us okay. Please let us know if you can't. I am thrilled to be joining you today with our distinguished professionals and advocates that will be joining us throughout the session today. Welcome and thank you for joining us for our How Lupus Affects AAPI Communities, our virtual symposium sponsored by GSK and in collaboration with Looms for Lupus. My name is Kelly, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And if you're unfamiliar with More Than Lupus, we are a multi-ethnic, multi-generational lupus community designed by lupus patients to connect and grow and inspire each other throughout the peaks and the valleys of our lupus journeys. And I say are because I've lived with systemic lupus since the age of 11. So, we believe here at More Than Lupus that every person living with lupus, no matter their background, should be treated with equity and dignity and taken seriously. And it's our mission that patients feel heard, that they feel seen, and that they feel valued. And if there are communities that are lacking in these areas, it is our responsibility to come alongside them and offer support. And by the way, before I forget to mention this, make sure you share this live event on your Facebook page because everyone who does so will be entered into a drawing to win a hard copy of the Lupus Encyclopedia, which is actually signed by the author himself, Dr. Don Thomas. So very excited about that. Now, today's event is our second installment in this year's Lupus and Minorities Health Series, where we continue to shine a light on underrepresented minorities that are disproportionately affected by the chronic autoimmune disease lupus. And if you are unfamiliar with lupus, we are going to have a breakdown about lupus and lupus nephritis by our first speaker, so stay tuned for more on that. Now, today also, we will be focusing on how this disease affects AAPI communities uniquely and hear from community leaders as well as medical professionals about their experiences. Now, unfortunately, Asian populations with lupus experience significantly higher organ failure than white populations. And as Dr. Thomas wrote in his newest edition of the Lupus Encyclopedia by Johns Hopkins Press, he told me I had to say that, they develop SLE at a younger age. AAPI patients with lupus have higher rates of antiphospholipid syndrome, have higher levels of arthritis, and neuropsychiatric SLE, not to mention higher rates of medical gaslighting. And many communities have lower levels of health literacy, which can all lead to negative health outcomes and distrust of Western medicine, and sadly higher mortality rates. So it's time that we as a patient community delve deeper into this conversation and continue this plan of action. And I'm thrilled to have patient engagement professional and lupus thriver, Dina Thachet, here to moderate today's pivotal and necessary dialogue. Again, so happy to have you back. So let me introduce Dina for you. Dina was diagnosed with lupus over 28 years ago, I believe. Is that about right? Yeah. Mm-hmm. After being hospitalized for a month and pronounced clinically dead 3 times, and was given a 5-year prognosis. Through this experience, Dina made a very conscious decision to use her lupus to help others learn how to advocate for themselves. Dina is exceedingly passionate about diversity and equity in all aspects of her life, and is a staunch advocate for addressing and eliminating health disparities, for addressing equitable healthcare and access issues, especially when it relates to minority health. So Dina is the proud and blessed mother of 4-year-old Isla, who lives in the suburbs of Chicago with her husband, and she has a degree in early childhood studies, is a certified child life specialist, and has worked for the Make-A-Wish Foundation for over 20 plus years. Welcome, Dina.
Thank you, Kelly. It's a pleasure to be here once again and an honor to moderate this incredible panel of experts. I'd like to thank you, Kelly, and More Than Lupus, as well as Juana and Estela Mata from Looms for Lupus, as well as GSK for sponsoring this incredible symposium. So let's get started. I'd like to start by introducing our panelists and our speakers for the day. Paula White is a nurse and patient engagement liaison with GlaxoSmithKline. So, Paula, if you could introduce yourself quickly, please.
Yes, hello, and thank you for having me here. Again, my name is Paula White. I am a nurse and a patient engagement liaison with GlaxoSmithKline.
Thank you, Paula, for being with us. All right. I'd like to also introduce Dr. Van Vu, a doctor of pharmacy and an AAPI lupus advocate.
Hi, thank you for having me. I am currently a pharmacist working within the hospital setting.
Thanks for joining us again. And I'd like to also introduce Jane Tiphayachan, an AAPI lupus advocate and health curator.
Hi, everyone. Thank you so much for having me. It's an honor to be part of this symposium.
Thanks so much to all three of you. And then I am going to toss it over to Paula, if you would like to get started.
Absolutely. Thank you so much. Dina?
Oh. I lost you guys for a second.
Again, thank you, everyone. I am going to speak with you, as Kelly and Dina said today, about lupus and lupus nephritis and being able to identify symptoms and really learn the importance of tracking symptoms when it comes to lupus and monitoring your disease, course of your disease. Again, as I said, I am a patient engagement liaison with GlaxoSmithKline, and my role really is to educate patients, to empower patients such as yourselves, to learn as much as you can about your illness and be able to manage your chronic lupus on a day-to-day basis and improve your engagements that you have with your healthcare team. So as we go through the content today, please take notes. With a little bit of technological difficulties we were having, there may not be slides on your screen, and for that I do apologize. But if you please take notes if you can, and I will give you information after we are done where you can access some of the content that I'm going to cover with you today on your own. So remember, keep in mind that everything that I'm going to present and share with you today is not to replace any communication conversation with your doctor related to your health condition or any treatment choices or options you may have. So let's start. I want to do a brief overview of what lupus is. I know we oftentimes have various I guess I should say people in the audience as to how long you have been diagnosed with lupus. You may be a family member here to learn about lupus, caregiver, a loved one as well. And then maybe you may be someone that has been part of the lupus community for quite some time. But let's just do a brief overview of lupus and some of the symptoms that you may be experiencing. So lupus is an autoimmune disease. Autoimmune diseases attack healthy, normal tissue in our body and cause inflammation, in turn causing the symptoms that we'll discuss in various organs of the body. The real diagnosis of a chronic illness is something that it lasts, greater than 3 months. In the case of lupus, lupus has no cure. And although there are treatments and things that you can do to help with the day-to-day symptoms of lupus, there is no cure for lupus. And it is usually characterized, those of you that have had lupus for some time will understand that there's times where you have good days and bad days, or periods of flares and remissions. So who gets lupus? There are about 1.5 million people living with a form of lupus. We're going to talk mainly about systemic lupus erythematosus today, or SLE. Women of color between the ages of 15 and 44 are the most common to be diagnosed with lupus. And that does include the Asian population, as Kelly mentioned, African American, Pacific Islanders, Hispanics as well. We don't fully know what the cause of lupus is, but scientists do believe that there is a combination of hormones and lifestyle, environment, and genetics involved. Something that may be surprising to some of you is that 1 in 10 lupus patients are men. We'll talk a little bit about the healthy immune system, the normal immune system, and then we'll talk about what the immune system looks like in relation to lupus. So in the normal healthy immune system, if you can visualize kind of like a bubble around yourself. So the immune system creates this barrier, if you will, that helps you fight off foreign invaders that may come into the body, such as viruses, bacteria, or any germs that may be in the environment. And this bubble or security screen around you is really what is known as your immune system. The immune system, as I said, helps fight off these foreign invaders to keep your body healthy and create something that is called antibodies in order to do that, to protect you. In the abnormal immune system, or in the case where lupus is involved, what is going on in the immune system for you is that the body begins to recognize normal, healthy tissue as foreign and begins to attack it rather than protecting. So your normal healthy tissues in your body can be attacked by what is called these autoantibodies and begin to cause inflammation in various areas of the body and attack and destroy your normal healthy tissue in various organs such as your eyes, mouth, skin, heart, lungs, kidneys. We'll talk a little bit more about joints and bones. So some of the physical symptoms related to lupus, then we'll talk a little bit about the visible and invisible. So when you're looking at the visible symptoms, these are things that your caregivers, your loved ones might recognize as a current symptom that you may be having during a lupus flare. So the classic, the rash that you can get on your face, that butterfly rash or malar rash, mouth sores, maybe swelling in your joints due to pain. Maybe you may be walking as if you're having pain and stiffness within your joints. You may notice weight changes, hair loss, where you can visibly see it when you go to comb your hair. Some of the more invisible symptoms when it comes to lupus impacting the body can occur in organs such as your kidneys, which is when we say lupus nephritis, that is just lupus that is having an impact or inflammation in the area of your kidneys. But this would be more of an invisible sign to others that we interact with in our lives. Something else would be, for instance, if you're beginning to have any troubles, maybe with your heart or lungs, like with chest pain or shortness of breath, these things may be feelings that you may have and people may not be able to see, or you may not be able to see them visibly on the outside of your body. Fatigue is another one. We can talk about fatigue above and beyond, normal fatigue. If you're getting sufficient amounts of sleep, but still feeling fatigue and worn out, about 80 to 90% of lupus patients do experience fatigue at some level. And then there's also other invisible symptoms related to like neurological effects, like headaches, depression, and brain fog. We talk about, maybe you getting confused or having memory changes or loss, irritability, difficulty concentrating. Those would all be considered more invisible symptoms. The importance of really understanding your symptoms and keeping track of your symptoms is so that when you have symptom changes or a new symptom, you are able to communicate that in a timely manner to your physician to make sure that he's aware of any disease process or maybe any additional organ involvement or changes in your history. So make sure of what we went over, that you are tracking that with a journal or a notepad or symptom tracker on your phone, that you're using something so that you are aware of your symptoms when you have your flares, when you're having good days, bad days. I want you to be sure to write those symptoms down and any symptom changes you may have. So we'll talk a little bit about lupus nephritis. So again, this is when the disease begins to cause inflammation and irritation, swelling in your kidneys, and can decrease the effectiveness of how well your kidneys are functioning. So about 35% of lupus patients will have some clinical signs of kidney involvement, and we'll talk about those in just a couple minutes. About 40% of adults will develop lupus nephritis at some course in their disease. So again, it's important that when we look at these invisible symptoms, and particularly today, talking about lupus nephritis and the organ change that can occur, I speak about it because the kidney involvement is more common in patients of color, as we mentioned, those of Asian, African American, and Hispanic descent. So I just want you to make sure, again, that you're monitoring your symptoms. And as we talk about some of the symptoms that you may begin to recognize if your kidneys become involved, that you're very proactive in reaching out to your physician. So in a normal functioning kidney, our kidneys typically will help us remove things such as waste from the body, helps maintain our appropriate blood pressure control. It helps create new red blood cells for our body, helps our bones stay healthy and strong, and also helps us keep appropriate chemical balances within our body as well. In someone who is beginning to have or has kidney involvement in relation to their disease, with that inflammation impacting their kidney and causing changes, you may start to see symptoms such as swelling in your hands, maybe in your ankles, your legs, maybe puffiness, swelling around your eyes. Please be sure to monitor your blood pressure regularly. You may or may not have a blood pressure cuff as a recommendation from your doctor at this point at home, but make sure that there is a way that you are able to regularly monitor your blood pressure. You may see blood pressure changes that are occurring. You may start to see changes in your urine. So whereas I said the organ involvement can be something that's invisible, it can also be something that you can see. So get comfortable with monitoring your urine. Stop, turn around and look at your urine when you use the restroom. If you start to notice any changes in color, notice any blood in your urine may begin to look foamy or like bubbly. That would be a sign that you want to jot down. You want to make sure to reach out to your provider, not wait till that next visit and share this symptom with them. You may notice an increase in urination, like at night. Maybe you're not one that has historically gotten up and used the restroom at night, but maybe due to some of the kidney changes, and I said that normal ability of the kidneys when they're healthy to eliminate fluid from our body appropriately may not be occurring as well anymore. And when you lie down, especially at night, it can cause you then to have an urge to urinate more during what normally you wouldn't maybe use the bathroom that frequently through the evening as well. So all of those symptoms, again, are symptoms that can occur if you do begin to have organ involvement related to the kidneys, as I said, or lupus nephritis. And with that, I would like to share with you again. I apologize if the slide content that I did have up to show was not able to be shown to you. However, I want to have you jot down. There is a site that you can go through GlaxoSmithKline's patient education site. It's usinlupus.com. So USINLUPUS, usinlupus.com. And you can read more about lupus nephritis there. You can read more about lupus within certain cultures and populations. You can get a symptom tracking kit there sent to you. Either download them to your phone, print them out, or have them accessibly mailed to you as well. So please reach out to that website and register for a symptom tracking kit through usinlupus.com, and you can learn some more information through there and look at some of the resources related to the impacts related to your kidneys, as I've spoken about today. So with that, I'd like to thank you for having me again today, and I'll hand it back over to you, Dina.
Great. Thank you so very much, Paula. Such incredible information that you've shared. And personally, I can appreciate that it's easy to digest. It's easy, you put it in terms that it's easy to understand, which, I think in Kelly's introduction mentioned that sometimes just being able to digest information, potentially if there's a language barrier or things like that. So I think just critical and important information to share. Caregivers, I think it's good information for them to know some of what we as patients deal with and might experience or might be watching for. So thank you so much for being with us. All right, so I will hand it over now to Dr. Vu.
Okay, so I just re-uploaded my slides. I don't know if Kelly or you are able to. Okay, there we go. Perfect.
Good.
All right. I should also first mention that I am living with lupus as well, and I've been so for 5 years. I wanted to address a challenge that we're currently facing as a whole as part of the healthcare system, but also more so in patients of chronic diseases like us with lupus. So medication adherence affects up to 50% of patients with chronic diseases like diabetes, hypertension, and us, of course, in lupus, even with great health insurance. And an estimated 125,000 individuals will die per year in the United States as a result of medication non-adherence. The general public and medical community often associate acute events as a result of chronic disease, such as a heart attack, to a patient's lifestyle, but rarely are these events associated with medication non-adherence. So in other words, we don't often hear the patient ended up in a hospital with a heart attack because he or she was not taking their prescribed medication. All right, can I get the next slide, please? Or do I maneuver that? Oh, there we go. Okay. So there are numerous barriers to medication adherence, and addressing all of these as a healthcare provider takes a lot of resources and time. Unfortunately, the current healthcare system in the US is not built to address many of these barriers. And in patients of AAPI descent diagnosed with lupus, these barriers may be amplified with less access to medications. So, for example, patients of AAPI descent may have cultural and language barriers. From my personal experience, I found out that lupus as a disease doesn't even exist in the Vietnamese language. Other barriers include experience and associated stigma with taking medications chronically. So family members may not understand why, we have to keep taking medications when we don't look sick. Oftentimes, patients are also more likely to be in denial until their health takes a serious turn. So, for example, until you end up in the hospital and that really affects your ability to function from a day to day, that's when you will start to notice a lot of patients take it seriously. So I've listed some of the barriers here. I think, you know, if you've been living with lupus, a lot of these are relatable in one way or another. We will face, you know, periods of lack of motivation to take our medications. We may be in denial. We can have, you know, the brain fog, other types of cognitive impairment, including drug or alcohol use. They're not resources, you know, that are readily available for people who may not have health literacy in their back pocket. And so there's a lot of different factors that contribute to this issue. For lupus in specific, the treatment is rather complex. We often see multiple medications on board that are taken with some serious side effects. So, which can deter patients more often than not to take these medication. And patient education is really key. Fortunately, we have more alternatives now for lupus treatments than we did a while ago that may allow patients to take these medications less often. And then, of course, we have the inconvenience of taking these medications along with cost and the time. Right, let's see if I can work this. Okay. So I wanted to touch a little bit on the side effects of a few medications that is commonly seen in lupus, and that may be more specific to the AAPI community. So as we all know, hydroxychloroquine, also known as Plaquenil, is like the lupus vitamin. Everyone gets it when you're diagnosed with lupus. It's widely used for lupus, rheumatoid arthritis, and other rheumatologic disease. Previous studies suggested that hydroxychloroquine retinal toxicity was relatively rare. However, more recent studies have shown patients who take it for more than 5 years has a reported overall toxicity prevalence of 7.5%. So retinal toxicity is generally with Plaquenil irreversible, and it can continue to progress even after you stop taking the medication. So recognition of that toxicity early is truly important. And the American Academy of Ophthalmology recommends a screening schedule annually after 5 years of taking this medication. When you go see your rheumatologist, they may recommend a more frequent screening than once a year, and that's, you know, will not hurt you. In patients of Asian heritage, the retinal damage pattern presents a little differently than the traditional, what we call a bull's eye. And so therefore, we may require different tests to detect and in turn more frequent eye exams. So from my understanding, now this is beyond my scope of practice, is that there needs to be eye exams that look at the wider region of the eye in order to see this. And so we may require more frequent eye exams as a result. Another medication that a lot of patients with lupus nephritis will end up on is mycophenolate mofetil, also known as Cellcept or Myfortic. This is also used in patients of solid organ transplants. So if you happen to have a kidney transplant as a result of lupus or other organ transplants, you may be on this agent. There is 2 types of different strategies in dosing. There is a fixed dose as well as a weight-based dose. And in patients of Asian or AAPI heritage, it's more preferred to use the weight-based dosing. So as you can see there, I've put the standard dosing of 1.5 grams daily or twice daily, excuse me. In patients who are smaller like myself, it would be more appropriate to use a weight-based dosing to improve the tolerability as well as the side effect profile. And there are several strategies to combat this unmet challenge of medication non-adherence that we're currently facing. What steps? Well, I think, in my opinion, as a pharmacist, the number one thing that I can do is to provide patient education. I address this issue on the daily as part of my job, and I found it to be impactful when patients understand why they are taking specific medications and the severity of the consequences when becoming non-compliant. Studies have shown a direct relationship between a patient's perception of the need for a given treatment and his or her adherence to the treatment. So another strategy that we may be able to address this nationwide issue, not just in the community of lupus, but also for other chronic diseases, is to approach it from a systematic standpoint. So addressing the development of programs and structures into the healthcare system, including dedicating medical professionals to help patients with medication adherence. And then lastly, we as a community need to increase public awareness. So for lupus patients in particular, it's vital to take our medications. Medication and non-adherence in lupus, as you may be familiar with, may equate to hospital admissions and potentially death for us. Like Dina explained, the previous speaker explained earlier with lupus, is that a lot of the symptoms are invisible. And so when you stop taking the medication, it's very easy to think that nothing is going on. But then it is happening within your body. And then when that starts to get really serious is when you end up in the hospital. And by that time, it really is too late. Kidney damage, lupus nephritis is not reversible. All right, and then the last thing that I wanted to address that Kelly touched on a little bit earlier is some of the vaccine hesitancy that we may see across patients with lupus especially. And her question is, how have I spoken open and honestly about this with my patients? And I think the three top things that came to mind for me was, one, educate. You really want to dismantle all the myths out there and replace it with the facts for the patients. I do give vaccines as part of my job, and I have the opportunity to present the information to the patient and explain to them the importance of getting COVID-19 vaccines, what it means to become infected with COVID-19 when you're a lupus patient. So, for example, as you've heard earlier, your immune system is overworking with lupus. So when you are faced with an infection of COVID-19, this is even more so amplified when your body is trying to fight off the virus. What that also means on another spectrum with respect to lupus is that it will start attacking all of your healthy issues as a response to your COVID-19 infection. And this may lead to a longer hospital stay, longer course of treatment, and potentially other consequences down the line as a result of your lupus disease. So it's even more vital for us within the lupus community to get vaccinated and get boosted. Now on our second booster recommended for patients with an immunocompromised immune system. And then lastly, I also like to share my personal experience. I think that anyone that comes into the pharmacy and had lupus or other chronic diseases and hearing, your story that, okay, I also live with lupus and I've been vaccinated, or here are my challenges with taking medication. It becomes a more of a personal connection at that point than me sitting there as the pharmacist telling my patient to take their medications. And at that point, when you are able to make that connection, able to establish that relationship and the trust, it becomes more easy to communicate with the patient that they do need to, try their best at taking their medications every day, and that what lays on the other side of things when your medication doses are missed is that you may end up with more severe courses of medications that can be even, more detrimental to your health and your daily life. With that, that's all I have for my portion. I'll turn it back to Dina.
Thank you so much, Van. So again, incredible information that you've shared today, both from a personal experience standpoint, as well as the professional and the medical, the importance of knowing what medications you're taking and having that education behind it. I can relate completely when you explained that there's no word for lupus in the Vietnamese language. Same in the Indian language that my family speaks. There is no translatable word for lupus or anything remotely close to it. So 28 years later, a lot of my family members in India still have no idea what it is that I face. And remotely, if any of them think that I might have cancer because it's immune system related, then they're just waiting for a phone call from my parents, because there's a stigma in India still to this day. If you get cancer, then you don't make it. So I can relate very much so, and certainly probably very common both in the AAPI community and other communities where language might be one of the barriers. So thank you for sharing. And with that, we will turn it over to our third speaker of the evening, Jane. Go right ahead.
Hi, everyone. So I've been a lupus warrior now for 18 years. When I was diagnosed, the lupus had attacked my kidneys, so I do have lupus SLE as well as lupus nephritis. It also attacked all the nerves from my left knee down, leaving me paralyzed and having something called a foot drop, which basically meant that my whole ankle, my foot was dropped like this, and I could not move anything from my left knee down. I could not move my toes. I couldn't move my ankles, nothing. So it left me in a wheelchair. After I got out of the hospital, I had to be transferred to a rehab center where, they tried to teach me how to walk again and shower and do simple things that, we would have taken for granted. And of course,
Jane, I think we have some technical difficulties.
Medication again. And it was just very difficult. But luckily, my family is from Thailand, and they have always believed strongly in Eastern medicine, in acupuncture, in nutrition, in herbs, and things like that. So they found that, this rehab center and all the medications that I was on was not really doing me any good and not making me any better. So they decided to take me to Thailand for 3 to 4 months, I believe it was. And there I saw an alternative medicine doctor in Thailand, and he did acupuncture on me. He showed me different stretches, different exercises, had me eating a different healthy diet, had herbs and, all these different things, and meditation. And, after 3 or 4 months, I was actually able to, reduce my pain medication. I was able to get up off the wheelchair. I kind of went from a walker to crutches, and then eventually, kind of just having a little wrap on my ankle and being able to walk on my own. So, I feel like it's definitely a blessing to be able to have the knowledge of Eastern medicine and alternative medicine in my life. After going through that, I really, decided I couldn't take life for granted anymore, and I need to find out what I wanted to do with my life, and that took me to my passion of getting my degree in beauty industry merchandise marketing at the Fashion Institute. So I went several years after that working. I worked my way up from a part-time makeup artist to a sales executive, and then boom, with more work and comes more stress, and with stress comes a lupus flare. So unfortunately, in 2015 is when I got super, super sick. I had the worst flare of my life. I was in the ICU at UCSF for over a month. The lupus had attacked my kidneys. It had attacked my lungs, my heart. I was intubated 3 times. I was on IVIG treatments. I was on chemotherapy, dialysis, blood transfusions, a numerous amount of times. You name it, basically. The doctors weren't really sure if I would make it, and they even told my family that they did all they could do, and they really don't know what else they're able to do, and to expect the worst. And my family, they are also Buddhist, and they had a lot of their family and their friends and their loved ones and people in the temple praying for me. And I feel like I personally had to fight myself and kept having faith that I would survive. And, luckily, I was actually able to, come out of the dialysis. They actually put a cord in my chest and said I would probably have to be on it for the rest of my life. But I was able to pee one day, and that meant that my kidney function came back just enough for me to take the cord out and be able to come off of dialysis, which was amazing. So, great things can happen, and you always have to continue to have faith and keep fighting. After this, my advocacy journey didn't come for a while until this huge flare hit. Then it was kind of like a wake up, and I was like, you know what, I have to help other people in my community. I felt like, after going through that huge flare, I really went to overdrive with becoming my own advocate and continuing to see a Chinese medicine practitioner who has helped me substantially through my journey. I changed my eating habits. I started juicing. I started making 3 mushroom tea, which is amazing for inflammation and pain and brain fog and all these different things. And seeing the Chinese medicine practitioner, I was able to come off of many medications too. I believe that it was a combination of me changing my eating habits, cutting my stress down, being more spiritual and finding meditation to kind of help me battle my stress. Excuse me. And I've been able to come off a lot of medication and just kind of find my own strength in becoming an advocate for my health. And from there, I really wanted to help my other lupus patients in the community. So I then became a lupus support group facilitator with Lupus NorCal and the House Foundation. And I did that for a few years, and then I took a little break because I did end up getting kind of sick again. So I kind of took a back seat and still, reached out to a lot of people in the community online. I feel like that's very, very important with advocacy, is your online community, because you have so many people who are going through the same thing that you are. And then you can spread advocacy and awareness a lot easier this way. You're reaching tons of people on there. So not only are you getting that support, but you're giving support to the rest of the community as well. And most recently, I have curated a list of health and beauty products. Since I worked in the beauty industry my whole life, I feel like I have all that knowledge of skincare and beauty, and that's something that can really help to uplift and, kind of give more confidence and, self-esteem and everything sometimes when we're feeling a little bit down. And it just mainly is to enhance the natural beauty and the natural, features that you have. And also I have curated a list of health products too, supplements and herbs and teas and different things that my holistic alternative doctor has prescribed me and shared with me, and I've tried them. They've worked for me, and you know, mind you, I do definitely still talk to my rheumatologist and my nephrologist about, you know, different things that I'm doing, and I keep them in the loop. But you know, some things they might not agree with, like the herbs are definitely something that they're always kind of sketchy about because they're not too sure what's in them. But I think that you have to sometimes make your own decision based upon like your doctor's advice, and you know, your holistic doctor and what has worked for you and how your blood results are coming back and everything. But again, definitely like reach out to your doctor if you have any questions or need advice. But this is something that has worked for me, and you know, I do have an Amazon account where I have all these products curated. So if you guys ever have any questions about health or beauty products, I have sunscreens and skincare on there too for sensitive skin and, you know, different things. You can definitely reach out to me if you have any questions. I've also started advocating through offering makeup classes to my fellow chronic illness patients. And, you know, I take the time, about an hour or so, to kind of run down how to do your makeup, what products to use, you know, talking about your skin type. And I just feel like it's something that I'm passionate about, and I can offer my knowledge with my fellow lupus community, and we can just kind of help to uplift and support each other. And that's about it.
Great. Thank you so much, Jane, for sharing such an incredible story and journey that you've been on with your lupus. You know, I think certainly always intriguing and interesting is those of us, you know, in the AAPI communities, and the you know, that balance and mix of Eastern and Western, and you know, what and how we can bring that into the conversation, and increase our just wellness in general. So thank you so much.
One last thing. I will say that I was very, very happy and impressed to know that UCSF is now offering like cupping. They're kind of starting to integrate more of an alternative medicine into their rheumatology practice, but it is called integrative medicine rheumatology. But it was just kind of really cool to be able to go to UCSF and get cupping and talk about nutrition and everything. So I'm kind of glad to see that that's kind of, you know, starting to mix in with, you know, our Western medicine too.
Absolutely. And, you know, as you so well stated as well, you know, making sure that we're talking to our rheumatologists and the rest of our specialists as well, and, you know, partnering with them to make sure that we're as healthy as we can be. So thank you so much, Jane. Thank you, Paula and Van and Jane, for sharing this incredible information. We have just a couple minutes left here for some questions. So I will start with one for Paula. Historically, AAPI communities are hesitant to seek medical intervention compared to white populations. How can the patient-doctor relationship be improved in the hopes of increasing better health outcomes?
I think, and I thank you, and I think, Dr. Vu, I think you even touched on this. I think it starts with trust and making sure that you are able to be in a healthcare environment where you're able to develop trust and have a two-way conversation. Sometimes that starts with the physician, but also perhaps with other team members that may be in the office that you may communicate with sometimes more. Maybe that's a nurse that's in the office that maybe you communicate with. But I think really getting the support maybe from a caregiver or a loved one, and then developing that trust with your provider, and really understanding, if you're not in an environment that is trusting and that you feel safe to open up and share, that it's important to get in that environment. And that's okay, because you have to be able to communicate your disease process, what is going on when you're not inside that office. And if that means developing, again, a relationship with maybe someone additionally in the office, as well as maybe taking a caregiver with you that can maybe sit beside you and help with some of that communication and develop some of that communication.
Great. Thank you so much, Paula. We did have a couple questions for Van, but I believe that you answered those in your presentation. So I think Kelly has one more question that may have come up in the comments or the chat.
Yes, I do. Hi, everyone. I snuck back on here. I've been working behind the scenes. There was a great question, and this is for Van as well. It's from Laura, and she said her daughter was diagnosed with lupus in August last year, and she is not wanting to take her hydroxychloroquine. She is only 9 years old. Any tips?
Yeah, it's especially hard with children, and as part of my job, we face this all the time because, as you guys probably know, our medication doesn't taste that great, or if you do think it tastes great, then we'll have that conversation and I'll see what I can, incorporate. But it's really hard to swallow a pill every day that tastes bitter or, smell bad. And to kids, if you can't even make them eat vegetables, what makes you think that, these medications that are, not that great even to adults, to have to do this every day. Clockwinil itself is a tablet, so you are able to crush it and break it apart into smaller pieces. A trick that I have learned with pediatric patients is if you give them something cold before taking the medications, you actually numb their taste buds. So something like a popsicle or like a ice cold drink, and make them take their medications, it tastes less bad to children. You can also hide it in applesauce on all the medications that are tablets, and kind of, here, have applesauce a day. Don't even tell them there's medications in there. That's the way you can sneak it. Or another way that we sometimes do on the pediatric unit is, if you take your medication, we'll give you some chocolate. We'll give you chocolate pudding. It's kind of like this reward system that'll motivate kids more to take their medications. Prednisone is a whole nother world of yuckiness that even I will refuse to take oral solution of, and sometimes those are prescribed to children. So I would say that those are probably the most easy, feasible tricks to do for children. And then we also have something in the pharmacy is called flavoring of medications if you do have oral solutions. And you can request that when you pick it up from the pharmacy. They'll flavor it like strawberry, they have banana, whatever your local pharmacy will carry. But
all right, Van, thank you so much for answering that question. And Laura, we are all thinking of you and your daughter and hope that these tips help her. And certainly all of us are here to support you as you and she maneuver this journey. So with that, I want to thank all 3 of our panelists, and then I will turn it over to Kelly to close us out tonight.
Yes, I second that, Dina. I'm so thrilled that everyone was able to join today. And for those that are watching this live and who will be streaming this later, hope you found it as informative as I did. This is our 3rd time doing this session in our continual plan of action to address lupus in minorities. And every time I learn something new. And so I'm very thankful for the professional patience, and also just your expertise and your knowledge, and just being willing to share your experience as well. I know that it means a lot to everyone watching as well as to myself. So time has come, my friends. We have Melissa here watching live, Veronica, Laura, Susan, Jean, Robin, Kathy, and Patricia, Melissa, Angie. I think I got them all. So we're going to do just a quick little raffle. Got you all in my little spin app here. And let's see. Let's see who wins. Oops, this is hard to do backwards. Oh, am I supposed to stop? Oh, it's Kathy. Can you see? Kathy, that is fantastic. Oh, Kathy, and she's local here in Portland. You just won yourself a hard copy of the Lupus Encyclopedia by Dr. Thomas. And guess what? He signed it for you. So I will get this to you this week. Congratulations. Thank you again, everyone, for joining today. This will be available as well by tomorrow on our YouTube station. So if you know someone who does not have Facebook who would like to watch this, they can watch it. And once it's approved, and we will get it out there to anybody else that you can share this information. Now, next up, we will have our How Lupus Affects Hispanic and Latinx communities, and that will be in September during Hispanic Heritage Week. And we can't wait to welcome you to that. And we're thankful for you being here today. Thank you again to our speakers, and we'll see you next time. Goodbye for now.